People who tend to have allergic reactions should not get the Pfizer coronavirus vaccine. That's according to a UK regulatory agency. It's now suggesting that anyone with a significant history of allergic reaction to a vaccine, medicine, or food should not take that vaccine. That also includes people who have been advised to carry an adrenaline auto-injector. This comes after 2 members of Britain's National Health Services experienced allergic reactions after they received the vaccine Tuesday.
But if we need to strengthen our advice, now that we've had this experience in the vulnerable populations, the groups who've been selected as a priority, we get that advice to the field immediately.
Tomorrow, an FDA committee will vote on whether to advise the agency to grant emergency use authorization for a vaccine here in the U.S. Well, getting a coronavirus vaccine out to the public is the most critical step to ending this pandemic. Tuesday, the FDA gave a signal that we could see that happen potentially as early as this weekend. NBC's Tom Costello shares the latest from Washington.
Good day. So tomorrow, Thursday, is the day that the outside FDA advisory committee begins looking at Pfizer's COVID vaccine data. But the FDA's review of that data suggests the vaccine is safe and with few side effects. And as you know, British health teams have already started using the vaccine there. While the vaccine requires 2 shots, the FDA says it was actually 50% effective after just a single shot. Now, Pfizer claims 95% effective after 2 shots 3 weeks apart. So once the advisory panel recommends action, the full FDA could issue emergency authorization within 24 hours. And so that means we could see Americans receiving the first vaccinations by this weekend, most likely healthcare workers. Now, that's the Pfizer vaccine. Another vaccine is made by Moderna. That also goes through the FDA review process. But will there be enough vaccine for everybody by the summer? Pfizer says it's already sold a big chunk to other countries, so the U.S. will be depending on Moderna and Johnson & Johnson and AstraZeneca as well. The U.S. is not just banking on one vaccine horse here. It's really betting on multiple vaccine candidates. I'm Tom Costello in Washington. Back to you.
Meanwhile, President Trump has signed an executive order to ensure Americans will be priority for the COVID-19 vaccines. The president signed the order at an Operation Warp Speed vaccine summit at the White House, attended by Vice President Mike Pence, health officials, and several governors. President Trump touting his administration for ensuring the development of a vaccine in a record time. He added, every American who wants a vaccine will be able to get one.